Hi everyone, my name is Anthony and welcome back for another virtual lunch and learn. This week we'll be talking about your time in the sun. We'll discuss the UV light you encounter and what your exposure time can mean for you. We would like to mention that this information is intended for educational purposes only and should not be interpreted as medical advice. We hope you enjoy. First, let's start off by testing your knowledge. True or false? Sun exposure can help our bodies produce strong bones. The correct answer? True. Consistent sun exposure can have multiple benefits as well as negatives that we will discuss here shortly. First, let's start discussing some benefits of sun exposure. When we are out in the sun, our skin is exposed to a form of radiation called UV light. When this happens, our skin begins to produce a vital mineral for our body called vitamin D. Vitamin D helps our bodies produce strong bones by making it easier to absorb calcium from our digestive tract and stimulates cells within our bones to utilize that calcium. Also, vitamin D helps release neurotransmitters within our brain that can positively affect mood. Thus, a low amount of vitamin D in the body can be harmful to our mental health, something we'll discuss further in the presentation. So how much vitamin D do we need? Our daily requirements change slightly throughout life and are measured in international units, or IU. For newborns up to a year of age, a daily intake of 400 IU is recommended. After that, 600 IU is recommended until the age of 70, at which case the number is again raised to 800 IU. While it may be possible to obtain a significant amount of our daily requirement of vitamin D from sun exposure, depending on certain factors, we can also consume this mineral in our food. If you are concerned about how much vitamin D you are getting daily, we recommend speaking with your doctor to discuss options that would be a best fit for you. So what are some factors that affect your ability to encounter UV light? UV rays are strongest during the hours of 10 a.m. to 4 p.m. Also, cloud cover, while it may prevent sunlight and heat from coming through, is not the best cover for UV exposure. The World Health Organization reports that 40 to 75% of UV rays can still penetrate through clouds, depending on how much overcast there is. It's also important to note that the UV light coming from above may not be your only angle of exposure, as those rays can bounce off of surfaces before they reach you, increasing the amount of radiation you absorb. For instance, normal ground and water cause a reflection that can send an additional 10% of UV rays to you. Sand will send about 50% more in your direction, and fresh snow can nearly double your UV exposure. On that note, we want to mention that there is a difference between UV light and temperature or infrared light. Just because it is a cooler day out does not mean that UV index is low, and thus both pieces of information should be looked at when planning activities outdoors. So how available is UV radiation in Minnesota? We can look at this graph and see what we may suspect. That availability is highest in the summer and lowest during the winter months, which align well with the direction the northern hemisphere is tilted in relation to the sun. When we're closest during the summer months, it results in stronger UV rays, and vice versa. So what happens when we receive too little UV light, such as during the winter? We do risk our ability to synthesize vitamin D, as our UV index lowers significantly as compared to summer months. If our levels of vitamin D get too low, we can potentially put our body at risk for several diseases. One that is more common in northern climates than southern ones is seasonal affective disorder, or SAD. While not too common, research has shown that northern states are about 5 times more likely than southern states to acquire the disorder, from about 2% to 10%. To avoid this, Mayo Clinic recommends getting outside when it's brightest out or within 2 hours of getting up, as well as exercise, since it can be a sufficient way to relieve stress and anxiety. If you are worried about your vitamin D intake or are experiencing anxiety or depression, we highly recommend speaking with your healthcare provider on some next steps for you. Now let's talk about the other end of the spectrum, when you're being exposed to an excess amount of UV light. With too much UV light, we can be exposed to a harmful amount of radiation. Recommendations suggest that once the UV index is as high as 3, significantly more caution should be taken to apply protective measures. However, this can vary widely. For instance, if someone is of fair skin color and is aware that they may easily sunburn, they may not need much exposure to cause damage to the skin. Each sunburn, no matter how mild, can build up to severe damage over time. Awareness groups note that if you've had one blistering sunburn throughout adolescence, your chance for skin cancer may more than double. The same can be said if you've had 5 or more sunburns throughout life. Awareness agencies also note that you may not need to experience a sunburn to increase your risk. as exposure to UV radiation can cause damage at a cellular level. So what are some things you might want to know about skin cancer itself? While serious, skin cancer can have a high success rate of treatment when detected early. So what are some things you should be looking for and be aware of? The most deadly type of skin cancer, melanoma, can be detected paying attention to your skin and any moles you may have and that may appear. Sun damage may cause moles to form, and some characteristics of those moles can help you determine if help is needed. We call these the ABCs of melanoma. When looking at moles, look for asymmetry. Is there an irregular shape or uneven halves? Next, look at the border. Normal moles will have a clean border, while those indicative of cancer may have a jagged appearance. Then, look for color. Your mole should be all one color, and seeing more than one may be cause for concern. Next, look at the diameter of the mole. A normal mole tends to be less than 6 millimeters, or the size of a pencil eraser. And finally, is the mole changing over time or evolving? If a mole changes in size, shape, or color, it is best to have it looked at. If you notice you may be experiencing one or multiple of these characteristics, or you believe you have another cause for alarm, it is best to speak with your healthcare provider, as they can recommend screenings and referrals to provide you the help that you need. So now that we discussed some of the concerns with UV exposure, what are some things you can do to protect yourself? You may have heard of the term SPF, or sun protective factor, in items such as sunscreen. So what does this mean? Ideally, it signifies how much longer you should be able to be in the sun before you begin to redden. For instance, if you apply SPF 15, it should take 15 times longer for your skin to redden than if you were not wearing sunscreen. This may be why darker skinned people may be at a lower risk for sunburns than fairer skinned people. Those with darker skin have more melanin, a dark pigment within their skin, that alone may provide an SPF benefit of 2 to 4. However, that's still not as much protection as you can get from sunscreen. The CDC recommends applying at least SPF 15, while Mayo Clinic supports SPF 30 or more. This may be due to SPF 30 blocking up to 97% of UV rays, and SPF 50 blocking up to 98% of rays. However, it is important to follow directions specific to your sunscreen when applying, and to remember to reapply as directed as well. The CDC also recommends throwing away old sunscreens every 1 to 2 years. And consider utilizing protective clothing as well that covers your skin and eyes, like hats and sunglasses. It is also important to remember that shade may not protect you completely, especially if you sunburn easily on days with a higher UV index, since those rays can be reflected off of surfaces, as we discussed earlier. Thus, avoiding that 10 a.m. to 4 p.m. window where UV rays are strongest may be best for some to minimize risk. So what are some next steps you can take? Consider planning around the time of day for when you go outdoors, as we know that UV rays are strongest at midday. Is it a day where you may need more sun exposure, or one where you may want to avoid a high amount? Also, begin checking your daily UV index so you know how you need to prepare for your days outside. Similarly, be aware of your location. Are there going to be areas where you can go to avoid and get out of the sun for a little bit? And also, set reminders to reapply sunscreen to avoid unnecessary time with exposed skin. I want to thank you all for joining me today, and I hope you're able to take away some useful information as we continue into spring and sunnier weather. We want to mention again that the UV radiation we experience from sun exposure can lead to both problems and benefits, and thus, if you ever have any concern about your overall health, your primary healthcare professional can be a highly valuable tool. Also, if you ever have any questions for us at the Place for Wellness about your health fitness journey, we would be more than happy to connect with you. Thank you.